Death by fire. How does smoking actually kill you? You probably already know that smoking isn't great for you. And if you're really worried about it, you could just stop doing it. But what does smoking actually do to your body? Well, here are a few ways smoking kills. Smoking kills by slowly causing damage to nearly every organ in your body. Now, it's not immediate. It's not like lighting up one cigarette and suddenly feeling deathly ill. Instead, it's a gradual process that unfolds over months, years, or even decades. A cigarette contains more than 7,000 different chemicals. Hundreds of these are known to be harmful to humans. At least 70 of these chemicals are also known to cause cancer. So that begs the question, what are the most destructive agents in cigarettes? First, there's nicotine. That's what's highly addictive and keeps people smoking despite knowing the consequences. But nicotine doesn't cause cancer directly. It does, however, harm blood vessels and increase both your heart rate and blood pressure. Then there's tar. It has a sticky black residue that coats the lungs much like soot coats the inside of a chimney. Finally, there's carbon monoxide, a poisonous gas. This replaces the oxygen in your red blood cells, starving your heart, brain, and other vital organs of the oxygen they need to function. But how do these chemicals lead to disease and ultimately death? Let's take a look. How does smoking actually kill you? We'll start with the most direct connection, cancer, which is essentially uncontrolled cell growth. First, there's DNA mutation. The carcinogens in tobacco smoke damage the DNA in your cells. If this genetic material gets scrambled, it can throw off the instructions for normal cell growth. So, certain genes might not send out the stop growing signal when they should. Next, we have tumor formation. When these damaged cells begin multiplying uncontrollably, they form abnormal tissue masses called tumors. If these tumors aren't removed or destroyed, they can eventually metastasize, meaning cancerous cells can break away and spread to other parts of the body, forming new tumors. Cancers caused by smoking include cancers of the throat or larynx, the mouth, esophagus, the tubes connecting your throat to your stomach, as well as cancers of the bladder, kidney, pancreas, stomach, cervix, colon, rectum, and acute myeloid leukemia, a blood cancer. Next is cardiovascular disease, which affects the heart and blood vessels. Here's how it works. Chemicals in tobacco smoke, particularly those in the tar, can damage the lining of your arteries. Over time, this damage causes the artery walls to become sticky. Consequently, fatty material called atheroma starts to build up inside the arteries, narrowing and hardening them. This condition is called atherosclerosis. In addition, smoking makes your blood sticky, increasing the chances of blood clots forming. If a clot forms in an already narrowed artery, it can completely block the flow of blood, and that's the mechanism behind a heart attack. It occurs when a clot blocks blood flow to the heart muscle. Similarly, a stroke happens when a clot blocks blood flow to the brain. If a clot blocks blood flow to the legs, it can cause peripheral artery disease. This condition results in pain when walking, and it can even lead to gangrene. In addition to atherosclerosis, smoking raises your blood pressure and your pulse rate, forcing your heart to work harder. Plus, the carbon monoxide in smoke reduces the amount of oxygen in your blood. All of this extra strain means your heart has to pump faster, which enlarges the heart muscle and weakens its pumping ability. Ultimately, smoking is a primary cause of heart attacks, strokes, and peripheral artery disease. Now let's talk about chronic obstructive pulmonary disease, or COPD. That's a group of diseases characterized by inflammation and constriction of the airways, resulting in symptoms like wheezing, coughing, and difficulty breathing. The most common conditions in this group are emphysema and chronic bronchitis. Emphysema happens when smoke destroys the tiny air sacs in the lungs called alveoli. These are the places where oxygen and carbon dioxide are exchanged between the air and your blood. As they get destroyed, the lungs lose their elasticity and the ability to absorb oxygen. In chronic bronchitis, the airways get inflamed and filled with mucus. Because of the irritation from the smoke, the body reacts by trying to clear the airways, which causes a chronic cough, the hallmark of chronic bronchitis. People with severe COPD often have to carry around an oxygen tank. Even the slightest exertion can leave them breathless. So far, we've covered the big three: cancer, cardiovascular disease, and COPD. But that's not all. Smoking also impacts nearly every other organ in your body. Here's a quick breakdown. The skin ages faster, develops wrinkles, and stains the fingers and teeth. Smoking increases the risk of cataracts and macular degeneration, which can lead to blindness. In women, it can cause infertility, preterm birth, and low birth weight. In men, it can contribute to erectile dysfunction. Smoking increases the risk of osteoporosis, a condition in which bones become weak and brittle. A smoker's immune system is weaker, making them more susceptible to infections and illnesses. In addition, smoking increases insulin resistance, making type 2 diabetes harder to control. Studies also suggest that smoking may be a risk factor for rheumatoid arthritis and autoimmune disease. All in all, smoking cigarettes is the leading cause of preventable death worldwide, killing more than 8 million people each year, including 1.3 million non-smokers who are exposed to secondhand smoke. Does any of this apply to me? If you're wondering how smoking might affect you specifically, it's worth noting that smoking reduces life expectancy by at least 10 years on average. And here's a grim fact: up to half of all lifelong smokers will die from a smoking-related illness. What if you quit? If you've been convinced that smoking isn't good for you, but you still haven't quit, the good news is that quitting works. Your body has an incredible ability to heal itself once the assault of chemicals stops. 20 minutes after you quit smoking, your heart rate and blood pressure drop. Within 12 hours, the carbon monoxide level in your blood drops to normal. Within 2 weeks to 3 months, your heart attack risk begins to drop and your lung function improves. In 1 to 9 months, coughing and shortness of breath decrease. After 1 year, the added risk of coronary heart disease is cut in half compared to someone who continues smoking. 5 years after quitting, the risk of cancers of the mouth, throat, esophagus, and bladder is cut in half. Your risk of stroke also falls to that of a non-smoker. 10 years after quitting, your risk of dying from lung cancer is about half that of someone who continues smoking. Finally, 15 years after quitting, the risk of coronary heart disease is the same as that of a non-smoker. In conclusion, smoking is a complex and deeply ingrained habit that affects millions of people worldwide. It's a significant cause of various diseases and premature deaths, but quitting can dramatically improve health outcomes and extend lifespan. Remember, knowledge is the first step towards change. By understanding the impact of smoking on the human body, we can make informed decisions to protect our health and the health of those around us. We would love to hear from you. What has helped you to quit smoking? Please share your thoughts in the comments below. Also, don't forget to check out other videos. Thanks for watching.